Do you know the difference between PCOS and myoma? Perhaps you've heard these terms before, but aren't quite sure what they mean. That's all right, because we're here to help you understand. PCOS, or polycystic ovary syndrome, is a hormonal disorder that is quite common among women of reproductive age. It's characterized by prolonged or infrequent menstrual periods or an excess of male hormones. On the other hand, myoma is a term that originates from certain cultures, used to describe a condition that affects women's health. Its symptoms and effects can vary widely, making it a bit of a mystery to those not familiar with it. Both conditions concern women's health, but they are not the same thing. They have different causes, symptoms, and treatments. Understanding these differences is crucial in managing and treating these conditions effectively. Stay tuned as we delve into the differences between these two conditions. First, let's explore PCOS, or polycystic ovary syndrome. Imagine a string of pearls. That's what PCOS looks like on an ultrasound, a string of tiny cysts around the edge of the ovaries. But it's not just about the appearance, it's about the impact on a woman's body. PCOS is a hormonal disorder common among women of reproductive age. It's marked by an overproduction of androgens, or male hormones, in the female body. This hormonal imbalance can lead to a variety of symptoms. Some women may experience irregular periods, while others may have very heavy bleeding. Some might have excess hair growth, acne, or even male pattern baldness. And for others, PCOS can lead to infertility. But why does this happen? What causes PCOS? The exact cause is unknown, but several factors may play a role. Insulin resistance, inflammation, and genetics are believed to be significant contributors. When the body doesn't use insulin well, the pancreas produces more to compensate. The excess insulin can increase the production of androgens, leading to PCOS. Inflammation levels are also usually higher in women with PCOS. And if your mother or sister has PCOS, your chances of having it are higher too. Now let's talk about potential treatments. It's important to remember that there's no cure for PCOS, but its symptoms can be managed. Lifestyle changes like a healthy diet and regular exercise can help regulate your menstrual cycle and lower your blood sugar levels. Medications may also be used to manage symptoms. Hormonal birth control can help regulate periods and reduce excess hair growth and acne. And for those struggling with infertility, fertility treatments may be an option. So, PCOS is not just about cysts on the ovaries. It's a complex condition that affects a woman's hormone levels, menstrual cycle, physical appearance, and even her ability to have children. But with the right knowledge and support, it can be managed. Now that we've got a handle on PCOS, let's turn our attention to myoma. Myoma, a term not as globally familiar, has unique aspects that distinguish it from PCOS. So let's unpack myoma, shall we? Myoma, also known as adenomyosis, is a condition where the inner lining of the uterus, the endometrium, breaks through the muscle wall of the uterus, the myometrium. This invasive action can cause an enlarged uterus, and guess what? Yes, you're right, it can lead to painful and heavy periods. The pain can be so severe that it disrupts a woman's daily life, and the heavy bleeding might lead to anemia. Now you might be wondering, what causes myoma? Well, the precise cause is still a bit of a mystery. Some theories suggest that it might be related to the hormonal changes that occur during a woman's menstrual cycle. Others propose that it could be due to an immune system response or even stem from cells in the uterus that were misplaced during fetal development. But let's not dwell on the unknown. Let's talk about what we do know, the treatment. Treatment for myoma is typically aimed at managing symptoms. Doctors might suggest hormonal therapies like birth control pills to regulate the menstrual cycle and reduce pain. In severe cases, a hysterectomy or removal of the uterus might be considered. But remember, everyone is unique, and treatment plans are tailored to the individual needs and circumstances of each woman. Myoma, like PCOS, can impact a woman's fertility. The changes in the uterus can make it difficult for an egg to implant, leading to challenges in conceiving. But it's important to remember, having myoma does not mean you can't have children. Many women with myoma have gone on to have successful pregnancies. So there you have it, folks. Myoma, in a nutshell, is a condition that affects the uterus, causing pain and heavy periods, potentially impacting fertility, but with a wide range of treatments available. Having looked at both conditions individually, let's now compare them side by side. PCOS and myoma, while both affecting women's health, have distinct differences. Diving into the differences between these two conditions, it's important to understand that polycystic ovary syndrome, or PCOS, is an endocrine disorder, primarily affecting the ovaries. It's characterized by high levels of androgens, or male hormones, irregular menstrual cycles, and cysts in the ovaries. On the other hand, myoma, also known as Asherman syndrome, is a condition where scar tissue builds up in the uterus, often as a result of surgery or injury. When it comes to symptoms, PCOS often manifests as irregular periods, excessive hair growth, acne, and weight gain. Women with PCOS may also experience infertility due to irregular ovulation. Myoma, however, often presents with lighter periods, no periods at all, or recurrent miscarriages. Some women with myoma might not have any symptoms until they try to conceive. Looking at the causes, PCOS is generally believed to be a result of a combination of genetic and environmental factors. Insulin resistance, where the body's cells do not respond properly to insulin, is often a significant contributor. Myoma, however, is usually caused by trauma to the uterus, such as a surgical procedure like a dilation and curettage, or an infection of the uterus. When it comes to treatment, PCOS and myoma have different approaches. PCOS is often managed through lifestyle changes like a healthy diet and regular exercise, and medication to manage symptoms. Fertility treatments may be needed if a woman with PCOS is trying to conceive. Myoma, on the other hand, is typically treated with surgery to remove the scar tissue. Hormone therapy may also be used to promote the regrowth of the uterine lining. In terms of their impacts on women's health and fertility, both conditions can cause fertility issues. PCOS can lead to irregular ovulation, making it difficult for women to conceive. Myoma can cause miscarriages and other pregnancy complications due to the scar tissue in the uterus. However, with appropriate treatment, many women with either condition can go on to have successful pregnancies. Lastly, it's important to note that while PCOS is a chronic condition, myoma can often be resolved with treatment. That being said, both conditions require ongoing management and regular checkups to ensure optimal health and fertility. As we've seen, while PCOS and myoma may share some similarities, they are indeed different in many ways. The key takeaway here is that if you or someone you know is experiencing symptoms related to either condition, it's crucial to seek medical advice. Early diagnosis and treatment can significantly improve the outlook for women with PCOS or myoma. In our journey today, we've learned a lot about PCOS and myoma. Both of these conditions are related to women's health, but they manifest themselves in different ways and have different implications. Starting with PCOS, or polycystic ovary syndrome, we delved into how this common hormonal disorder affects women of reproductive age. We learned how PCOS can lead to irregular periods, excessive hair growth, acne, and even fertility problems. It's a condition that is often linked to insulin resistance and can increase the risk of developing diabetes, heart disease, and high blood pressure. On the other hand, we explored myoma, a lesser-known condition that also affects women's health. Unlike PCOS, which is hormonal, myoma is a type of benign tumor that grows in the uterus. These tumors can cause heavy menstrual bleeding, pelvic pain, and complications during pregnancy and labor. The key differences between these two conditions are important to note. While PCOS is a hormonal disorder that affects the ovaries, causing a variety of symptoms and health risks, myoma is a condition that involves the growth of tumors in the uterus. Both conditions can impact fertility and menstrual cycles, but their causes, symptoms, and treatment options are different. Appreciating these distinctions is vital. It can help individuals become more aware of their bodies and more proactive in seeking help when something doesn't feel right. It's always essential to remember that each woman's experience with these conditions can vary greatly. Understanding these differences is crucial for women's health awareness. It's all about informing, empowering, and encouraging women to take charge of their health. It's about fostering a conversation that breaks the stigma and encourages open discussion about women's health issues. Always consult a healthcare professional if you think you may have symptoms of either condition. They are the ones best equipped to diagnose and treat these conditions, providing the necessary care and support. Thank you for joining us, and remember to subscribe for more health-related content. We're here to provide information, debunk myths, and promote a healthier, happier life for everyone. Let's continue this journey together, one video at a